Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm here today with Dr. Christina Hibbert, and we're going to talk about her upcoming presentation, Perinatal Mood and Anxiety Disorders. Welcome, Dr. Hibbert.
Thank you, Kristen. It's a pleasure to be here.
It is so wonderful to have you here with us today, and you are going to be talking about a very, very important topic, perinatal mood and anxiety disorders. But before we jump into the topic, can you tell our listeners a little bit about yourself, about your background and your professional journey?
Absolutely. I became a psychologist several years ago, about 15 years ago, when I was already a mom myself. So I actually had 2 small children when I went back to graduate school to get my doctorate. And at that time, I had already been through 2 postpartum experiences myself. And so that kind of led me to focus on perinatal mood and anxiety disorders as I went into graduate school and to do my dissertation in that area, as well as to start some support groups and also start working out in the community with women and mothers in particular. And I kind of learned through graduate school that I really love working with others who have similar experiences to things that I have personally gone through myself. I've been through many life experiences that always sort of have led me in the direction of, the psychology work that I do and speaking and teaching and the book writing that I do. And so actually, my last year of graduate school, I was even pregnant with my 3rd baby and gave birth the week after I graduated with my doctorate. So I am very familiar with this topic in many ways, and as well, just how hard it is to be a mom, and that's why I've kind of focused my career on that. I started out after graduate school in a group practice to get licensed and sort of just to get some experience. And then through some other life experiences, I've kind of, stopped practicing psychology on and off when I had another baby and had a major life change that we'll be talking about in the presentation, and then started my own private practice. So I've been working in a private practice for several years now and became an author a few years back when I decided to write down the experiences of my family and what we had been through that, again, I'm teasing for what we'll be talking about in the presentation, and that became my first book, my memoir, This Is How We Grow. And since then, I've been fortunate to publish 2 other books and now to be working on my 4th book, Mastery of Motherhood, and to be able to do a lot of online work as well through my blog and my web radio show, Motherhood. And yeah, I love psychology because I love that we can understand each other so much better and we can use our own life experiences to help us help other people.
Wonderful. Thank you for sharing that with us. And from what you are just telling us here, this was a very personal story for you. This is personal, right? Christina, this is personal. You experienced postpartum depression yourself in your journey. And you're a psychologist, so tell us a little bit about, how did it help you being a psychologist, recognizing the signs and symptoms, or, were you kind of detached in being in your own role of mother? Can you tell us a little bit, without going into too much detail, but I just find it very interesting because that's such a personal journey you were sharing here with us.
Yes, absolutely, and you're right. I did experience postpartum depression with my first, and I had always wanted to be a mom. I had graduated from college the year before. I had just gotten married. I was ready. I told my husband, let's just try to have babies right from the start, and little did I know how young and inexperienced I was or how hard it would be once I did become a mother. But that didn't prevent me from struggling with depression, and it really hit hard because I really felt like not only was I struggling with my own, health and wellness, and I felt like I had to take care of the baby all the time, and I had to be the one to, handle everything, and I wasn't sleeping, and we ended up moving in with my parents and actually living on the floor of their living room for 3 months while my poor husband was trying to go to school and work, and I was just trying to figure out how to be quote, a good mother, because that's the biggest part of all of these disorders is it's such a rough start to motherhood, and it's right when we want to be at our best and be giving our best and performing our best, and when you're struggling with depression or anxiety, you can't. You feel like you can't, and that's where we get that deep, deep self-worth issues that pop up, and I feel like they stay with us as mothers across the board. So to me, that's kind of become an underlying focus of my work is, you know, self-worth in motherhood, and how do we help mothers to feel like they're not alone, to know that, you know, when they struggle with a mood or anxiety disorder or even something more extreme like psychosis, that there is help available and that it's not their fault, and to give them the skills that they need to make it through, and not only just to, as I say, overcome, but to go beyond that, to become their best self and their best mother self, and to flourish in motherhood and throughout the rest of their lives. Because what I see is when you have that rough start, if you don't know these things, if you're not given the opportunity to change and to grow in this way, a lot of times moms just carry that lack of self-worth throughout motherhood. And it, you know, we don't want moms to have to feel that way. So I'm very passionate about helping mothers because of my own struggles. And that was just my first baby. I had postpartum depression and anxiety the second time, and the third time, right after graduate school, I had more of the anxiety. And then the fourth time is the experience that I'll be telling everybody about, this, my big life-changing experience with postpartum.
Thank you for sharing that. And Christina, I can just hear the passion in your voice. It is just wonderful hearing you sharing your story there and sharing what you learned and hearing how passionate you are helping mothers, helping others. And you mentioned a very good point there when you were talking to us here, saying how can we help mothers? And I feel like often for medical care providers, we feel like a little bit out of our depth right there. You know, we want to help and we just don't often know exactly how. So that's why this kind of presentation that you're bringing to the table is so important, right?
Yes, and I completely agree, and that's really what I'm hoping everybody will take away from the presentation, is that how. That's always my favorite question. We might know why we're doing what we're doing or what we're doing, but the how is the question, and it really is simpler than we think to be able to reach mothers. And I know a lot of times, you know, when we're talking about perinatal issues, our focus is on a healthy baby, and we want that, but we know that maternal depression is the #1 predictor of future behavioral and cognitive problems in children, and we know that maternal depression is a global problem. This isn't just in one country or developed countries, but it's a global issue around the world, and we want moms to realize that depression isn't just part of motherhood, and we want healthy moms so that we can have healthy babies. So I'm hoping that through this presentation, the participants can understand these clinical skills that are very simple but can help us to better reach mothers, better connect with them, better assess what they're going through and identify their challenges, and then provide that kind of support and care and love that helps walk them through the process of getting the help that they need, so they truly know they are not alone and that they will be well.
Well, thank you so much, Christina. Dr. Christina Hibbert here with us. I'm very much looking forward to this wonderful presentation, and thank you so much for sitting down here with me today.
My pleasure. Thank you so much for having me.
Thank you. And Dr. Christina Hibbert's presentation, Perinatal Mood and Anxiety Disorders, Essential Clinical Skills, is our keynote presentation for the Gold Perinatal Online Conference 2018, and I hope you will join us for this presentation. This presentation is open access, so open and available to everyone, and Dr. Christina Hibbert will be presenting twice live on October 1st. So please share this information with all your friends and colleagues, our listeners here. And to learn more about this presentation and the other presentations in the conference series here, in the Perinatal Online Conference, go to goldperinatal.com. Thank you everyone for listening here and participating with us today. Bye-bye for now.